Dear ladies and gentlemen, given that we are few remaining in this session, we have to start. And we are opening the oral session number 5. Co-chair Davide Pigiano from Italy. Third co-chair is not present, but Aisha is coming. I would like to announce the first speaker, Ozan Helvacı, FMF-Related amyloidosis in Turkey, a wound that still bleeds. We have to find out if the speaker is here. Oh, sorry. Okay, let me please.
Thank you. You members here. It's getting pretty late, so I'm going to try to be brief as possible. I'm going to try to answer that question. Is FMF-Related amyloidosis in Turkey still bleeding? You know, amyloidosis, since Virchow described it in the 19th century, is very well known. Most ancient physicians knew the condition. That AL, AA, and other amyloidosis types were not distinct until recently, like it's been like 50, 60 years. But they knew that amyloid in myeloma or amyloid in suppurative conditions were different than each other. Familial Mediterranean fever is the disease of this part of the world. It's probably as old as Galenic times. Some patient depictions of Galen may resemble FMF. First modern reports date back to 1900. Properly identified in 21st century, lots of different names were proposed, but after Heller's paper in 1958, FMF prevailed. That was the groundbreaking work of Heller and his colleagues. It's a catchy phrase. I'd like to inform you that the Turkish version of that is ailesel Akdeniz ateşi. Ailesel familial, Akdeniz means Mediterranean, ateş means fever. But we never use it because it becomes abbreviated as 3 A's and it can be mixed with aorta abdominalis aneurysms. And we also, Turkish physicians, have adapted the term FMF. In daily speak, we use the term FMF, and most of our patients catch the phrase too. It's a pyrene gene disorder. Innate immunity cannot be suppressed or is overreactive. Autosomal recessive disorder with incomplete penetrance. It may confer survival benefits, as many of the diseases with the founder effect or very common in certain populations would confer such benefits. It's a very recent publishing that it can induce genetic protection against black plague. And maybe some of the cancers, FMF patients tend to get some cancers less than normal population. It's characterized by recurrent attacks of fever, pain. It's 9% becomes symptomatic in childhood. It affects Turks, Arabs, Jews, Armenians, and countries with coast to Mediterranean Sea in the past. It's diagnosed with typical history and rapid response to colchicine nowadays, but genetics can be used for atypical cases, and it results in AA amyloidosis if left untreated. First reported Turkish case dates back to 1946 from a Jewish Turkish physician, Samuel Abrahaya Marmaralı. He was also a politician. Bir garip karın ağrısı syndrome and enigmatic syndrome of abdominal pain, English title. Dr. Elif Frank, on his book I presented to you recently, he says, I translate that literally, we came across this disease in Istanbul very frequently. That's why we are going to discuss this in great detail. He wrote that it was common in Istanbul. It caused pure nephrotic syndrome, caused amyloid nephrosis. It could be also asymptomatically found in some kidney biopsies, and there were multiple secondary causes: osteomyelitis, chronic pyelonephritis, bronchiectasis, tuberculosis, malaria, and tertiary syphilis. Amyloidosis and FMF was first demonstrated by two professors from Ankara University in 1967. They published their kidney biopsy findings in Annals of Internal Medicine. 63 patients had amyloidosis on their biopsy samples, and half of them, 50% of them, underlying cause was the familial Mediterranean fever. Since then, it was followed by this great-looking flower is in Turkish we call it çiğdem, is Latin Cochium autumnale. It has antipyretic and anti-inflammatory properties. It's been known since again Galenic times. In 1972, Dr. Goldfinger of Massachusetts General published a letter in New England Journal of Medicine of 5 patients, and after following broader studies, colchicine became the single agent gold standard drug for FMF. After colchicine era, we have this great publication by Dr. Nesim Beşbaş and her colleagues. They published 300 children with FMF, proper colchicine treatment, and only 2% of them developed amyloidosis. If you look at the textbooks, you will see that 2% number repeating again and again. It comes from that study. The prevalence of FMF was, by Sökmen and Özdemir, estimated in 3 in 1,000. Better estimation of studies, it was like 1 in 1,000 in worst case scenario. Prevalence of amyloidosis in FMF patients is very debatable if you do a biopsy or presumed amyloidosis, but several small studies report 7 to 29%. Its mean of them is like 10%. We have published a nationwide center study in 2005. Mean age was 23. There was a great diagnostic delay, approximately of 7 years, and 13% of the patients had proven amyloidosis on biopsy. Reporting on that, our pediatric nephrologists did a great job and handled the case very diligently. And after that time, that rate decreased to 2% for pediatric patients in 2009 or 10. But cause of secondary amyloidosis in Turkey, familial Mediterranean fevers stays the leading cause. And there is no downward trend. This is a pediatric biopsy registry case in 2016, I guess. That amyloidosis, prevalence of AA amyloidosis in all the biopsy samples remains around 1%. In the literature, it's 0.5 to 3%. There are tons of other studies. I'm not going to take your time with them. They are single-centered and low quality of evidence, but we somehow deduce some knowledge from them. Secondary amyloidosis still occurs. No exact downward trend in the last years. FMF is the still leading cause, 20 to 70% of cases in multiple studies. I did not put it in there, but Turkish Society of Nephrology Registry says 1 to 2% of all incident hemodialysis cases are due to amyloidosis. But what we don't know now is the total number of patients with FMF, those with amyloidosis, proven or presumed, total number of AA amyloidosis, their underlying etiologies, current prevalence of FMF, and current diagnostic delay. Why we don't know that? It's a rheumatology and nephrology diversion. Most FMF cases without amyloidosis are followed up in rheumatology departments, and some of them with mild amyloidosis are also followed there. Presumed case of amyloidosis after that, and we have tons of immigrants and refugees. They may contribute to this first, we don't have a national registry for amyloidosis. We have a national registry for other things, but not for amyloidosis. A road plan could be a joint registry for nephrology and rheumatology. Public education to downward trend diagnostic delay and physician education, especially under first care. In that, to answer that question, a bone that still bleeds, I don't think it's an arterial bleed as it used to be. It's venous or capillary bleeding, but we need some more data to answer that precisely. Probably yes, but it's bleeding much less heavily. Thanks for your attention.
Thank you very much for a very interesting presentation, which is now open to discussion. There are some questions from the audience. Actually, I see no. As far as we know, my colleague David and I agree that we have never seen this disease in our countries, even that we are both from Mediterranean countries. So the question will be, how do you explain this regional appearance of disease?
In the Jewish part of the disease, they are mostly likely to be non-Ashkenazi, and consanguineous marriage is common, and unfortunately in Turkey it's still common. And the founder effect carrying that mutation to most likely is assumed to be like 2,500 years old mutation. It was in Middle East that migrated to other parts of the world. That's why you can see it's in Morocco and Tunisia, and most of the, I follow up the French papers and Italian papers, most of them are like North African of descent, patients of descent. I believe that was a founder effect in Turkey and other parts of the Middle East, like Armenians and Jews, and due to the rate of consanguineous marriages here. But I'm not sure why Italy and France and Spain does not have that much of a number of FMF patients.
Okay, thank you very much. It's very interesting because if it is a genetic origin, then because of worldwide migrations, it could spread.
There is something else, but it is not totally genetic like autosomal recessive.
There should be something else.
It has incomplete penicillin, and there's a very interesting study that it was done in Turkish children who have relatives in Germany. They were family, they were relatives, they had the same mutations, but the children in Germany had fewer attacks and fewer presentation of symptoms. There is something external going on.
It should be something environmental. It should be something environmental for the expression of the disease.
There's an environmental trigger, and that was before the pyrin gene was understood in 1992. We had some testing, like we gave adrenergic agents to these patients to trigger attacks. That's like alpha agonists to trigger attacks on that. That's why I believe there is something else going on. I agree with you.
The same story was with the multiple nephropathy. Yes, because we thought before that there is a genetic influence, but finally we found out the environmental issue, aristolochic acid, and then we completely understood the disease.
Yes, in Turkey, do genetic testing for all. You will find tons of patients with FMF mutations in both genes, but completely asymptomatic.
Completely asymptomatic.
Yeah.
Thank you very much.